Related deaths in our country. It's also the second most prevalent cancer among South African women. But now South African researchers are turning up the heat on cancer, and this is quite literally doing that. They're exploring a technique called hypothermia, or heating tumors to enhance sensitivity to radiation. Let's discuss this with Carrie Minnaar from Wits University, who joins us in the studio. Thank you so much, Dr. Minnaar, for joining us today. Now, quite interesting, because just before we went on, you were telling us that you are a doctor in radiation sciences. Now, we know radiation, a key treatment for cancer around the world. Talk to us about this the thermal treatment now that's come into place, this hypothermic oncology.
So thank you, yes, and it's a pleasure to be here. So in hypothermic oncology, what we're doing is heating up the tumors, and the technique that I use is called modulated electrohypothermia. It's a mouthful, but it's very selective, so it focuses just on the tumors without damaging the healthy tissue. And what happens when the tumors are warmed up, they're more susceptible to the damage done by radiation. So, and also it inhibits the repair mechanisms from the damage done by radiation. So that's why we combine the two. So hypothermia is mostly used with radiation, and in some instances it can also sensitize the tumors to chemotherapy, but vast majority of the cases it's a radiosensitizer.
So can one just engage in hypothermic oncology or hypothermic treatment on its own, or does it have to be combined with radiation and chemo?
So the literature is mostly on combined treatment. There are some small studies where it has been used as a standalone treatment, but that's in a very palliative setting. So as a treatment for curative purposes, no, not by itself.
And does it matter at what stage of the cancer you are in?
So early stages of cancer usually are more easily treated with standard treatments. So surgery, maybe local radiation, especially cervical cancer. Surgery in early stages is usually curative. But the more advanced the cancer, the more difficult it is to treat with standard treatments. So then we would add the hypothermia treatment to the radiation in order to improve the outcomes.
So can you talk to us about the science of it all? How the heat actually reacts with the tumor and what causes it to become more receptive to...
Yes, with pleasure.
Yes.
For the tumor. But it was very difficult, and still is very difficult, to achieve those very high temperatures without safely preventing the healthy tissues from being damaged. So it sort of lost popularity because the complexity and cost of the treatments became just too high for it to be feasible. And then in the early 2000s, some researchers in America started publishing results on how mild heat could increase the blood flow and increase the radiation damage. So it sort of stemmed from their research that manufacturers in Europe started producing devices that could heat to lower temperatures, making it much more feasible, and also safer and more cost effective.
You're saying that your research results are yet to be published. What are the success rates that you've experienced thus far?
So we have published our 3-year results, and we're just waiting for the publication of our 5-year results, although we have already presented those results at a conference in Europe. And the 5-year disease-free survival results that we presented in Europe showed that the addition of hypothermia more than doubled the chance of getting to 5 years disease-free in cervical cancer women, and we treated women stages 2B to 3B.
Cape Town is where this treatment can be found, and you said yourself where it fits.
At the Donald Gordon Medical Center.
At the Donald Gordon Medical Center, that's where the other treatment can be found.
That's where I am, yes.
Now, we're all talking about a post-diagnosis of cancer. Could we maybe talk about some preventative measures to actually not even reach that stage where we're having this kind of discussion?
Yes, definitely. So what's alarming is that 80% of the cervical cancer cases and deaths actually happen in low to middle income countries. And this is really because we don't have access to the preventative measures that other countries do. So it's very important that we increase the awareness and the uptake. So first of all, screening. Regular pap smears, If we can find abnormal cells before they turn into cancer, then we can manage those cells. Well, I say we, the doctors can manage those cells and remove them. But in order to prevent any abnormal cells from even developing, we have a vaccine that, if we give to girls before they become sexually active, can significantly reduce their risk of being infected with HPV, which is the human papillomavirus. More than 90% of cervical cases are actually caused by chronic infection with HPV. So being vaccinated, very important. Regular screening, very important. And any abnormal symptoms, if you're bleeding outside of the menstrual cycle or postmenopausal bleeding or anything that's abnormal, you definitely need to get that checked.
Go to your gynae at least once a year.
Definitely, definitely.
Well, Dr. Carrie, thank you so much for your time today, and all the best with this. And I certainly hope it does go around the country, be accessible to a whole lot more people. We certainly do need more solutions to treating cancer. Thank you so much for your time, and happy Women's Day once again.
Thank you very much.
All right, that's Dr. Carrie Minnaar from Wits University at the Donald Gordon Hospital, and also in Cape Town. She says those are the two places where currently you can actually access hypothermic treatment for cancer. So to all the women of our nation, we take care of ourselves, not only intellectually, in our careers, but also physically. Still coming up for you today from the sports desk with Morena Mutupi. It was indeed the clash of the North African giants in Paris. Morocco obliterated Egypt to take bronze at the Olympics. More in just a moment.
Morocco, an incredible performance in the Olympic bronze medal match from the Atlas Lion Cubs.
Aviation is a male-dominated field, so a lot of the rooms I walk into, I am either the only female or one of very few females.
I had to get to know more about boats and how the engines work and all of that in order to get respect in the environment from other men.
Back then, you have parents that believed, especially my father, may his soul rest in peace. He believed that a girl child, no, the school is not for a girl child.
The thing that excites me about this is a girl knowing about cars. That's like everything.